Welcome to this tutorial from AlliedMatch, your learning and certification partner. Motor neurone disease, or MND, is a progressive neurological condition. As it advances, the muscles used for breathing become weaker, making it harder for the body to remove carbon dioxide. We'll be focusing on how to safely support individuals with motor neurone disease, or MND, who may develop hypercapnia, that's high levels of carbon dioxide in the blood, and may be using oxygen therapy or non-invasive ventilation. Understanding this balance is essential to protecting our service users. MND is a progressive neurological condition that causes muscle weakness, including the muscles needed to breathe. Over time, breathing becomes harder, not because of lung disease, but because the muscles that help us breathe are getting weaker. Hypercapnia happens when the person isn't able to get rid of enough carbon dioxide, or CO2, through their breath. This is common in MND. As care workers, we're not diagnosing, but we do need to spot the signs and report them. The key signs to look out for in someone with rising carbon dioxide are morning headaches, daytime sleepiness or naps, breathlessness, especially when lying flat, confusion, irritability, or agitation, red or flushed skin. You might think giving oxygen would help, but in MND, giving oxygen without a proper plan can be very dangerous. Here's why. People with MND often rely on low oxygen levels to stimulate their breathing. If we give them extra oxygen, we can accidentally reduce their urge to breathe, leading to a buildup of carbon dioxide and even respiratory failure. That's why oxygen should only be given if a doctor or respiratory team has prescribed it, and often, it's used together with a ventilator. You might see a service user using non-invasive ventilation, commonly referred to as NIV, like a BiPAP machine. This helps push air in and out of the lungs and removes carbon dioxide. Our job is to help them use it safely, not to adjust the settings, but to make sure the mask fits, the machine is working, and that they're using it regularly, especially at night. If they stop using it suddenly or say it's uncomfortable, report it immediately. Let us go over the do's and don'ts as a care worker. Do's: follow the care plan. Help the person use their oxygen or NIV as prescribed. Look for signs of hypercapnia or respiratory distress. Use fire safety precautions. Record and report any changes. What you should not do as a care worker. Don't start or stop oxygen on your own. Change oxygen flow rates. Ignore drowsiness, confusion, or breathlessness. Adjust ventilator settings. If you notice sudden confusion, breathlessness, or a change in consciousness, don't wait. Call 111 or 999 if the person becomes unresponsive or is struggling to breathe. Also notify your manager or the district nurse team straight away for any new or worsening signs. Supporting someone with MND is about more than physical care. It's about keeping them safe, respecting their choices, and acting quickly when something changes. Learn more about supporting your service user at www.mndassociation.org. You're not expected to be an expert in ventilation, but you are a crucial part of the safety net. Know the signs, follow the plan, and don't be afraid to speak up.